Good morning, everybody. Today, I shall talk about three-dimensional imaging and also discuss about multi-slice computer tomography. As described earlier, three-dimensional digital image matrix has individual image or picture element called voxels, where measurement in terms of height, width, and depth can be assessed, so that far more detailed information regarding the implant site can be obtained than do the two-dimensional images. These three-dimensional images include complex imaging techniques which as follows: multi-slice computer tomography and cone beam computer tomography as stated earlier. These non-invasive and fast imaging allows exact measurement of the alveolar ridge due to its spatial relationship and favorable implant site for osseointegration. Such type of imaging are recommended by both American Academy of Oromaxillofacial Radiology and European Association for Osseointegration. Moving to the multi-slice computer tomography. Multi-slice computer tomography is a digital and mathematical imaging technique that creates tomographic sections which enables differentiation and quantification of both soft and hard tissues. Multi-slice computer tomography scanning is widely used in the evaluation of the implant. In CT, a fan-shaped beam of X-rays and an array of detectors rotated 360 degrees around the patient to generate axial slices of area of interest. The patient is positioned in a supine position and with the head centered and immobilized by using the jaw strip or sponge pads on either side of the temporal region. The patient are instructed not to move, swallow or chew during the acquisition process. Data acquisition is performed parallel to the hard palate or interocclusal plane or alveolar crest to allow better orientation of the cross-sectional images. These slices are then used to generate digital volume of the imaged object with the help of computer and sophisticated algorithms with the standard filters or with bone filters. Axial images are obtained with the following parameters. Detector coverage of 40 mm per rotation, where 512 into 512 matrix with a 16 cm field of view, in which the section thickness and separation between the thickness is about 0.6 to 1 mm in 64 row scanner and 1.25 mm in 4 row scanner, where the rotation time is of 0.35 seconds for 64 row scanner and 0.6 seconds for 4 row scanners. Images are reformatted with dental software program or interactive reformatting software to panoramic or sagittal oblique images of the maxilla and mandible by superimposed curve axial images. A curve is superimposed on an axial image of the maxilla or mandible approximately at the level of the tooth roots, thus defining the plane and location for reformation of the panoramic and sagittal oblique or paraxial or cross-sectional images. In patients with edentulosum, the curve should be obtained where the outline of the mandible or maxilla is shown completely. Then these images can be printed on photographic paper or transparent films or can be displayed on a computer screen. As discussed before, the individual elements of the CT image are called as voxels, which has a value referred to in Hounsfield units that describes the density of the bone on the CT image at that point. The density of structures within the image is absolute and quantitative and can be used to differentiate tissues in the region and characterizes the bone quality. Quantitative and qualitative assessment of the bone can be done with the clinical correlation. You can see in the table as D denotes the density of the bone as given by the Kalmish by correlating the spongy and cortical bone ratio thickness. You can appreciate the descending pattern of bone density which referred as D1 to D5, where decrease in the Hounsfield units can also be seen. Next, moving to the advantages of CT scan. CT scan offers several advantages for the evaluation of the patient. True cross-section offers a precise and detailed evaluation of the height and width of the alveolar ridge for implant placement. CT possesses almost all ideal characteristics for implant imaging, which enables identification of the disease, determination of the bone quantity, identification of the critical structures at the proposed region, and the determination of the position and orientation of the dental implants. These images can be adjusted and printed out without magnification, facilitating measurements directly on the prints or films with the standard rulers. Vertical and horizontal rulers adjacent to each section allows the clinician to check for magnification and make direct measurements in a digital image. The digital format allows also for image enhancement tools. This rapid communication between the radiologist and the surgeons and the generation of the multiple copies of the image. Various anatomic structures can be visualized and analyzed at all three coordinate axes so that their superior, inferior, anterior, posterior and buccolingual location of the identified with precision. The bone and soft tissue contrast and resolution are excellent for the diagnostic task. CT scan also possesses certain disadvantages, which includes CT scanning requires specialized equipment and setting. Radiologist and technician need to be knowledgeable of the anatomy, anatomic variants and pathology of the jaws to give any of the diagnosis for that radiograph. The CT scan delivers much higher radiation dose to the patient than any other imaging modalities used during implant treatment planning. Because a CT scan images the whole arch, radiation is delivered to the entire imaged area. Metallic restoration can cause ring artifacts that impair the diagnostic quality of the image. In general, the cost of the CT is significantly higher than that of any of the conventional imagings or other standard intraoral or extraoral projections. To summarize, CT scanning offers many advantages for proper diagnosis during implant treatment planning, including accurate cross-sectional imaging and three-dimensional visualization of all the anatomic structures. But high dose to the patient and certain artifacts caused by the metallic restoration, if present, are of concern that should be considered. Thank you.